Hello, my beautiful people. Hello, hello, everyone. Hello, everyone. You're welcome on today's program. Hello, everyone. Hello, everyone. Hello, everyone. You're welcome on today's program once again. My name remains Labake Elizabeth Akintunde, the anchor of your Health Matters program. Today, we have a beautiful guest that's been on the program before. And for most of you that are actually familiar, that have actually been our fans, join me to welcome. I also welcome the new people that are joining for the first time. Join me to welcome Dr. Fikayo Shode. You're welcome, Dr. Fikayo. Can you please introduce
Hi,
yourself to my
hello
guests?
everyone. Hello everyone. So like you said, my name is Dr. Fakaya Strobshode. I'm a GP. I specialize in women's health. I have a background history of, working in obs and gynae, pediatrics, also urology as well. But my main passion is women's health. So it's a pleasure of mine to be here today.
Thank you so much. Like I said to you, she's been on the program before, and I know she's a very, very busy lady. So, on today's program, we actually are going to be discussing menopause, and we thought about not leaving our men out on this special edition. So, we are going to be talking about andropause as well. So, Dr. Fikayo, what exactly is menopause medically? What do we mean?
So menopause is the natural and permanent end of monthly periods and fertility. Is officially reached after 12 consecutive months without a period. So that's what menopause is when you had no periods for 12 months consecutively.
Good. So does it has to do with age, or does it is it at what age do people should expect? Because there's this controversy around in terms of it's for the elderly people. Now we are hearing different things like young people are experiencing menopause. What age did you think menopause normally occur?
So the average age in the UK is 51 years old, but it can happen between 45 years and 55 years old. And anything that happens, if it happens before 45 years, we call that early menopause. And then if it happens, before 40 years old, then it's called premature ovarian insufficiency. So usually with menopause, it's between 45 years to 55 years. Is different around the world. It's been found that with Black people and Asian people, it can occur earlier. So usually around like late 40s. Um, but with the UK, it's typically around 51 years old average age.
Oh, thank you. That's actually really good to know. How do we diagnose menopause? How do people know? Because sometimes you, like you said, it has to be absence of menstrual period for 12. How do we actually think? When do you advise that people should actually decide to go for the checkup?
So I always say, so there's a difference between, so menopause is 12 months without a period. But before that, we get something called perimenopause, and that happens before menopause has actually taken place. Now, that usually starts around the mid 40s. You start to get symptoms that suggest that you are going through the change. So, majority of women describe it as going through that change. So I would say by the time you start getting symptoms, which we will discuss, I would advise to, seek help or discuss it with somebody like maybe your GP.
So I think you just took me to the next question. So what are the
Okay.
common physical symptoms that people need to be aware of? So no, I am actually experiencing perimenopause or menopause or post-menopause.
So, with the symptoms, the common symptoms are usually what we call vasomotor symptoms. So things like hot flushes, night sweats. You start to get irregular periods. So if your periods were, monthly before, then they start. they stop being, every month. They could have like a delay of like 3 months, 4 months.
Oh,
Majority of people complain about mood changes, sleep issues. There's also like physical symptoms that affects the private area, the vagina area. So things like vaginal dryness, and you get stuff like reduced libido. Yeah. So those are the
ooh.
common symptoms.
So is it the same for every woman or individual probably will have different symptoms? How does it work?
So every woman is different. The most common ones are the vasomotor symptoms. It affects about 75% of the women. So things like hot flushes, night sweats, those things. But every woman is different. There's no, particular, you know, typical stage of all the symptoms for one person. Everyone has different, it can vary. So there are things like brain fog, things like reduced concentration. Some people go through it, others don't. Irritability, some people go through it, others don't as well. So it is different for every woman.
So I think you just made mention of my next question because I was going to ask that does the menopause or before we go into that, let's dive a little bit. Like I said at the beginning, we're going to carry our men along. So what is
Yeah.
andropause then?
So andropause is in relation to men is something that men go through. Is also it's not a true equivalent to menopause. What men experience is a gradual reduction in the male hormone called testosterone. So what you get is a decline after the age of between 30 to 40. It's a gradual decline, and fertility is always preserved. When you compare it to menopause, where women lose their fertility, which is the ability to carry a pregnancy through natural conception, with men, fertility is usually preserved. Um, and that is also diagnosed with clinical, it's diagnosed with symptoms. So you just discuss the symptoms and you test the testosterone of men on 2 occasions.
Oh, that's actually good. So, like for everybody who actually have asked me the question, please, when we get to the time that you want to ask for the question, for people who are not in UK, the same number on the flyer, you can call the WhatsApp number and ask your question. I'm going to deviate a little bit, Dr. Fikayo. There's this question somebody sent and said, does menopause affect physical health? Does it affect like heart rates? Or you just mentioned that it does affect the libido, but does it affect, and you said it affects the sexual health, does it affect any other physical health like heart or any other thing that we need to be aware of? Or
Yeah, so
increases the chances of
sorry.
having, or does it increases the chances of having any physical health issue?
Yeah, so with menopause, what happens is you get a decline of the female hormone, which is estrogen and progesterone. And what estrogen does usually, it's very what we call cardiac protective. So it helps protect the heart.
Hmm.
So with menopause, there's an increased risk of things like heart disease. Also, it affects your estrogen affects your bone strength as well. So when women go through menopause, there's a risk of things of development of osteoporosis, which is the weakening and the thinning of the bones. So it can affect physical health in that way.
So I'm gonna be a little funny now. So in a way, so menopause is the one affecting that or the lack of sex.
No, it's menopause. It's what lack of sex.
Okay,
I
good.
don't understand.
So I
No, it's
think
it's
the
menopause.
question is does menopause increase the rates risk of heart rates which we've dealt about? Does it
Yeah.
affect sexual health and libido?
Yes, it does. Yes, it does. So it reduces your libido, because the estrogen goes down, which is and estrogen is very important in lubricating the vagina area. So what women complain mostly about is vaginal dryness during the menopause.
Mm,
And obviously, when it's dry in that area, sex is not as, comfortable, it's not as pleasurable. So it can reduce it in that way as well.
okay. Thank you so much. So let's actually look at the statistic. I think you might have mentioned it earlier on in terms of I think you've mentioned the age range. So and I think you've mentioned also about the regional ethnic differences. But my question is now, like you said earlier on, it actually affects the Black minority. Why is that? Is it because of the food we eat? Is it because of our gene? Why is that?
So no one has actually done a study that actually shows the actual reason. I think it could be the culture, the fact that it's not it's not comfortable with the Black, community talking about it. So the reason why it could happen earlier could be more things like stress related.
Mm,
So there could be more stressors. It could also be linked to things like our diet as well, because we have a carbohydrate rich diet as well. So there's been some link with that, but there's no specific cause. It's just that they've just noticed that with Black and Asian women, it can happen earlier.
wow, that's actually really good to know. So let's dive a little bit into the male andropause.
Okay.
You did actually talked about a little bit earlier on. So how is it different from menopause? Because obviously we've established that um that actually when a woman has gone fully into menopause, that can actually debar them from conceiving naturally. So
Yeah.
what is the difference between menopause and andropause?
So like I mentioned earlier, so menopause it stops after 12 months. So your period stop, fertility stops. That's how you confirm after 12 months of not having periods. Whereas with andropause is a gradual decline of testosterone levels. And it typically starts after the age of 30. So it happens earlier compared to women. And it becomes more pronounced between the ages of 40 to 60. And the symptoms of that is you get fatigue, you could get reduced libido as well, you could get irritability, you could get muscle loss as well. But fertility is maintained. So, whereas with women, fertility stops, we're not able to have kids through natural conception. But with the men, they carry on having reproductive ability. So you can see 70-year-olds and 80-year-olds still being able to have children. Um, so that's the difference between both.
Wow, that's actually good. So there's this question: can a woman still obviously um we talked about the peri menopause earlier on. So
Yeah.
the question now is when a woman is in that stage, can they still have a child? Is there any chances, any statistics or research that they can still get pregnant?
Okay. So with perimenopause, which is the change leading to menopause, women are
Mhm.
still getting their periods. So even if it's irregular, there's still a chance of pregnancy. So we always encourage to use contraception, to use protection to stop that from happening. During menopause, we always advise that you carry on using contraception a year after you carry on a year after the menopause had stopped because there's also a chance that it could cause pregnancy. So just to make sure 100% that to keep you covered.
That's good. So We've actually established 1 minute. Let me copy this question from the. So actually, we're going to probably open the line earlier today because I'm actually
Okay.
have to be reading out the question from the Facebook. You understand? So,
Yeah.
so the next question I have here is that are there any medical options for childbirth after menopause? Obviously, we know about the other people that have been talking about whatever. So, what are the medical options for childbirth for women if they've not had a child and they've gone to menopause?
So the you can't get pregnant after menopause, but you will need a donor egg, and it's usually through IVF. So you will need an egg from someone else. And what they can do is they can prepare the lining of the womb with estrogen and progesterone. So those are the ways one can get pregnant after menopause. But you can have a child. It's just that the child will not be biologically yours. You wouldn't have your genetic makeup. You have to get an egg from someone else.
Oh, so in a way, what advice will you give people then? Because if they're actually within the perimenopause, can they then preserve their egg at that stage, or what do you recommend?
Um, I, yeah, if you're going to, anyone can reserve the egg at any time, but obviously, it's important to know that as women get older, the quality of the egg do reduce. So I would say if you're thinking about, fertility down the line, it's better to freeze your eggs a lot
Hmm.
earlier, not when when you're younger, compared to when you're going through the perimenopause. It might just be harder to get some egg reserves during that period of time.
Could it be because I think the next question you've answered already, what causes menopause in younger women? I think you've talked a little bit about that. Is there any other things we need to be aware of or any other way of avoiding into going to menopause at early stage?
So there are different causes for going through early menopause. One of the cause is things like medication. So um yeah, so things like medication, also, smoking, having there's some autoimmune diseases that can cause early menopause. It's not really much we could do to stop it. Um, when it comes to things like some people would have had, like, for example, medical procedures where they've removed their ovaries. There's not really much we can do regarding that. But there are lots of different causes of early menopause. I think it's just each treatment it depends on the actual patient themselves, on the actual person.
So the is there any treatment option for menopause symptoms? Because I think some people were talking about therapy, HRT, and how does it work?
Right. Okay. So, like I mentioned earlier, menopause is literally the reduction of female hormones. So, things like estrogen and progesterone. So, the treatment for menopause, the most effective one, we always say, is hormone replacement therapy. And hormone replacement therapy is a way of replacing the hormones that has been lost. So, we'll give estrogen and progesterone. It
Mm.
depends on if a woman is also had a uterus or not have a uterus. Some people have had their womb taken out, for example. The treatment is different because in that way we would only give estrogen. But if the uterus is still present, we'll give a combined hormonal replacement, which is the estrogen and the progesterone. They can take it through gel, so transdermal, so through the skin. So you can either have the gel or a patch, or you can have it orally as well. And what that does is it prevents things like bone loss, like I mentioned. It improves um, like the vaginal dryness, the sexual part of things as well. Um, and then another option, the non-hormonal options is things like is medication like SSRIs. So they are called like antidepressants. They help with the hot flushes and the sweats as well. So those can help. And then for vaginal dryness, non-hormonal treatment includes things like vaginal moisturizers. But you can also have hormonal vagina estrogen as well, because that will help with the lubrication down below. So those are the treatments.
So we're going to open the line now. The number to call to ask question is 07345003484. Can one of the admin please put it on the page for us? So please call in. It's actually ideal that you call in and ask your question. It's not been convenient to be juggling, reading your questions out on the Facebook while we are live. So it's actually okay that we can check after we finish the Facebook, but let's actually go and call in and ask the question now. So we'll be able to, the doctor is online now. You can call in from abroad, like I said, from wherever part you're calling using the WhatsApp number. And then there's this actually. So I think the last question I have here, um, is there any lifestyle remedies that can help for you not to go to early menopause? Is there anything we could do to help ourselves so that we don't go into early menopause?
So things like eating a well-balanced diet, um, practical things, making sure you're not overweight or obese, exercising. More with women is strength training, so lifting weights. What this does is improves your bone and also your metabolic health. Stress reduction, so things like mindfulness,
Mhm.
cognitive behavioral therapy, all that would help. Just practical advice, daily habits to help um stop the symptoms happening and affecting you so drastically. It's not obviously something that we can stop because it's a process that happens naturally, but there are ways that you can reduce the impact of it on your health.
Okay. So I think that's actually from the doctor's mouth. So if you have any other questions, please call in. The number is 073 45003484. I hope that's actually the number on the flyer. Yes, so you can call in to ask your question and then we'll be able to. Thank you so much. So there's this question somebody put in here. What daily habit helps women manage menopause better? I think that's actually what the doctor just explained just now. Then the next one, what myths about menopause should people should stop believing? What are the myths about menopause that you want people to stop believing?
Right, okay. So one of the myths is menopause means you are old. No, it doesn't mean that. It's just a natural change that happens with women. There's also the myth that HRT is dangerous for everyone. It's not, it's highly effective. Some women, I've got patients that HRT has literally changed their life and it's made, their life a lot more better. Obviously with HRT, there is a risk, there's a very tiny risk of things like breast cancer and clots but it's very, very small, and the benefits of using it actually outweighs the risk of using it. So that's the myth that I would like to stop for people to stop believing. Also, things nothing can be done. There are things that can be done to help improve a woman's lifestyle. So definitely, those are the myths that I would like everyone to stop, you know,
So
believing.
thank you so much. I think that answered your question. um the meat is actually, yeah, that's actually the question the doctor just answered now about the meat. So I think that takes me to, is there any other thing, Dr. Fikai, that you like to share in terms of that? Those are the questions from me. Any other information you want to dish out now? You actually have the floor to add to whatever information that we are not aware of, that's actually not within the question that people needs to be aware of in terms of menopause and andropause.
Yeah, so I mean, I just want to explain that, women, we need to be more in touch with our bodies. It's not good to suffer in silence. If you have any symptoms or you feel like you're going through the change, if it's happening before the age of 45 and you're worried, it's very important to go and see your GP. If you feel like you're going through the change before the age of 45, there are blood tests that can be done just to check to see. Obviously, after the age of 45,
We
it's,
have a caller, so let's actually pick the call. Hello, you're welcome on today's program.
Hello, Labake. Hello, good evening, Dr. Fikayo.
hello, hello.
I'm calling just to gather more information. Firstly, thank you for this topic. Thank you for the topic, because sometimes it could be embarrassing to talk about menopause, the myths, behind menopause, and this, because I know that myth, but I didn't know it was called andropause. But thank you also for that. So my first question is, how do societal perception of aging affect men's experience with andropause? And secondly, with menopause, I heard that it does take a long time as well. Some people say they've experiencing menopause for like 11 years, 15 years. Is this true? And how can they manage with it? I know you talked about the HRT, but some find it still difficult living with with daily day-to-day for that lengthy period, and also discussing it with their partners to understand, how the lady's coping or feeling, and that she's not just being grouchy, grumpy, but due to, the the change in the system. Sorry, I hope I'm not rambling on.
So I think what we will do is that actually take you back to the first question. And then when she answered the first question, then you can go ahead with the second question. That's okay.
Okay, that's fine.
Thank you.
So my first question is, how do societal perception, because this comes to men, the masculinity and where, so how does the societal perception of aging affect men's experience with andropause?
So did you grab that, Dr. Fikayo?
No, it was going off a little bit. Please,
so how does the society perception affect the men's? Go on then, caller. I can.
How does the societal perception of
aging, okay,
affect affect men's experiences with andropause? So men's experience, when they're aging, how does the societal perception affect their aging when they experience andropause?
So the question is, how does society perception of aging, societal perception of aging affects men? Men's experience in andropause.
I feel like with men, it's not, a lot of men don't even know that they go through andropause. So it's not something that is talked about, I don't feel, with men in general. how the societal pressure of aging. I'm not really sure what she means, like the
Okay,
social
the
type.
question maybe is to break it down. Is to break it down. You know, men are assumed to be macho, to be, but how does with the societal influence that a man has to be strong, the testosterone now dropping, now not being able to discuss with their doctors or with their partners or with family or friends, how does this affect them within the society?
So I think the caller is asking in terms of the usual match.
Yes,
You understand the usual beliefs in terms of men needs to be strong. An African man, you're not expected to cry. You understand everything. You have to buckle up and everything. So, do you think those perception, those opinion, those thoughts could affect the reason why men are not talking about andropause, or is it that they're not even aware at all? Is that right? The cooler, is that
Yeah,
right?
I don't think men are aware, and I think obviously because, like you said, you're right. Men have this, they have this pressure on them to be macho. They have this pressure on them to not. They don't talk about their health issues. They should appear to have everything all figured out. It kind of limits, their health, them seeking help for their health. So some guys don't even know that it happens. They could just notice that, oh, they're not feeling themselves, but they don't explain it or they don't want to talk about it. So they keep it suppressed. And obviously things like that can lead to further health issues, things like it can affect their mental health, it can affect their ability and concentration at work and things like that. So I think it's very important to raise awareness regarding you male andropause, definitely making them aware of it, that it does happen. It's not similar to women, but as women are getting older, the testosterone is going down as well.
So then, yeah, let's go to the second question.
What are the resources or support available to help these ladies or to help women in general when we're going through menopause? Is there any support system out there to help when we're going through menopause?
Did you hear that?
No, sorry, I didn't hear that. I completely
So
missed that.
yes, sorry. So the question is actually, is there any support for women within a society who are going through menopause?
Yeah, so there's lots of support. If you go on the website menopause.org, there's lots of forums available where women discuss their symptoms. Sometimes they meet up. The most important thing is to see your GP as well, because not everything it needs, treatment like medication. Sometimes it could just be something like I mentioned, talking therapies, all that can help, you know, because it's a huge change for us. So it's important to have someone to talk to. Um, but talking therapies definitely help. Counseling helps to discuss the symptoms.
So I think did you hear that?
Thank you so much. Yeah, I did. Thank you so much, Dr. Fikayo. Thank you so much.
Thank you so much. Yeah. So Dr. Fikayo, I think there's this question somebody is sending on the email. I don't know why people are not calling. Please call in. So I don't have to be the one. It's actually much better when you're calling. So I think the question this individual is asking is in terms of that how do you advise men to support, or what clinical advice do you have for men, both men, you understand? Because like you rightly said, men are not aware of andropause. Some of them are going through it, but obviously they're not even aware of it. So what advice, but the women one are very known due to the mood, hormones, and those flushes and everything. What advice do you give to men to support the wife going through menopause? So how can they support their wife during these stages?
So I think it's important as women also to make the men aware that okay, something is there's going on, there's some changes, and you need to advise them on some of the changes that are going on. If you feel comfortable, you can even take your partner to your GP appointment with you, so it's not that they can get further confirmation as to what the changes are. The best way to support is just to listen, to be there for them, also to help around because menopause can cause tiredness. It's important for the woman's feelings not to be dismissed, and to just encourage them not, if someone is tired, for example, it's very important not to be called lazy. So it's just trying to be there, trying to offer support. If there are things that the person cannot do, or if you find that the person is becoming irritable, or little things is making the person irritable, you know, just be in a safe place, leaving things, letting things calm down, not, aggravating the person even more. Would be helpful. But I think it's important for women to explain to their partner that I've noticed certain changes, and this is what I feel like I could be going through, because menopause is not a quick thing. It's something that would happen for years. So they need to be understanding towards that.
I think that I have a question here. So if a woman is going through all the identified symptoms but still having their menstrual period, could they be on perimenopause or what? Is there, I think what this individual is asking is that I think they identify symptoms of what menopause, but they still having their menstrual period. Could that means that they're going through perimenopause, or could those symptoms be for other things that is not menopause?
Um, so it could be related to something else. It's important because it's important to kind of figure out what it could be. If things, because menopause is diagnosed through symptoms, basically, it's just a clinical diagnosis, is what we call it. So if you're having all those symptoms grouped together, then it's likely that it could be menopause. But we can also rule out other causes like that. So sometimes you could get those symptoms if you have like a thyroid issue. And that is just a simple blood test to check your thyroid level to rule that
Okay.
out. But most of the time if you're having all those symptoms together and you're over a certain age, it's likely that it could be um perimenopause or the menopause. But we also feel like we can definitely rule out other causes as well.
Thank you. I think this is actually out of my own curiosity. So
Okay.
because um we just talked about when people are having their period and maybe having these symptoms, but obviously it's not possible for somebody to be in menopause still during the menstrual period and having those symptoms. That's not possible, isn't it? That has to, for us to conclude, according to what we both had earlier on, is that it has to be absence of a menstrual period for 12 years. I mean, 12 months.
Yes, that's how we diagnose it. But you can carry on having the symptoms until about, you know, 4 years, 5 years post. It can happen. You can carry on having the symptoms. But only
Okay.
a small percentage of women have it after 10 years.
Wow.
The symptoms, I mean.
Yeah. And they're still having their period on. So
No, they don't have their
that
periods.
so that's the difference, because this individual is asking the question is if you're having the symptoms and you're still having your menstrual period.
Or if you're having the symptoms and you're still having your menstrual periods, that is
Mm,
perimenopause.
that's perimenopause. exactly what I thought. You understand? So
Yeah, that's
yes, exactly.
perimenopause.
So that's perimenopause, and you said
Yeah,
that could
because I
last up to
mentioned
four.
that the average age of actual menopause is 51, but perimenopause can start from like 45.
No,
So you can start
so
getting the
yes,
symptoms.
we are still in the safe zone then. Silly, silly. I don't know who that is. You're still in the safe zone then. I don't actually know who that is. I'm gonna check later. So I think that's actually, thank you so much, Dr. Fikayo. That's actually really wonderful. I am learning as well. Trust me, there are quite a lot of questions that we'll probably have to go back to. So I think I'm live now. Well, sorry, somebody just called my attention to my Facebook is actually in private. I didn't put it in public. So you will be limited to the views people who are watching at the moment. But as soon as we finish, I'm going to go and change the setting and put it in public. Or my Facebook is always in private,
Oh, is it
and
on
then I
private?
think
Oh, okay.
is in private. Sorry, I just realized. So I'm always actually putting it in public just for the benefit of the show. But we'll do it and we'll share it, and then other people can actually benefit from it. We can't do that while I'm already live. So the number actually is still. I can see a lot of questions you're putting on the Facebook. Please call in to ask Dr. Fikayo. We have the GP here. You can actually ask more questions rather than putting it on there. We are not able to go later to be reading, though Dr. Fikayo will be kind enough to pop in on our Your Ex Notice page to
I will.
respond to more questions there. But it's ideal that you call in now. You know, you can call in now. You don't have to mention your name. Like I always, I'm always aware of confidentiality. You don't have to say your name. Just call in and ask your questions. The number it remains 07345003484, and we're going to put this live program on the YouTube. So we have a caller. Hello. Hello.
Hi, and well done for this program. My question is actually for doctor, and I just wanted to check: is it normal for someone to be bleeding for over a month based on perimenopause? And then when I went to my GP, I was given a medication to use. I'm a bit skeptical on using it because I'm just like, okay, I don't know why I'm bleeding, and you've just given me medication to use. I don't know. Is it normal? Is this something that I need to probe further? Like I told my GP today that he needs to send me for maybe a scan or something just to know the reason, that just to check that I'm okay. So is it normal to be bleeding for over a month and it's actually very heavy?
Yes, so perimenopause can cause irregular and heavy bleeding. Um, for a month, I probably will want to investigate further. Well, over a month, I want to investigate further just to rule out any other causes. It can happen, but it's always better to, make sure that there's nothing else going on, to make sure that you're 100% sure that it is the perimenopause and not something else. But it can happen, yes.
So do you advise that I use the medication I was given?
What medication were you given?
It's Tranex
Tranexamic acid?
acid, yes.
Yeah, you can use the medication. What it does, it should stop the bleeding or reduce the heaviness of the bleeding. But I would go back to my GP and say, is it possible to get like an ultrasound scan?
Yes, he's actually put me for referred me for an ultrasound scan, but he said for to me to use the medication, and I'm like, okay, I don't know. I've read about
Yeah.
the medication. I know it's not good to Google things, but I've done that,
Oh
and it's
no.
not looking, it's not looking, um, it's not looking interesting. What I've read about it, so it's going to stop the bleeding, but can also cause blood clots or something like that.
Yeah. So it's a blood. It helps with clotting the blood. So that's how it stops the bleeding.
Ooh.
Yeah, but if it clots the blood now, what will that blood what will it do to my system? I don't know.
No, it
I'm
would
just.
go. It would leave your system.
So I think I can understand where the cola is coming from. So in order to stop the bleeding, the medication will clot the blood.
Yes.
Yes.
Is there anything she needs to be aware of?
No, it's a very safe drug. It's a very common drug that we prescribe for anyone with heavy periods, or yeah, heavy painful periods. Um, I haven't heard, much about, side effects regarding the medication. Majority of women tolerate it very well. Um,
Oh,
Okay.
yeah.
I think to add to what Dr. Fikaya said, so if I were you, as soon as I start taking the medication, I'll book into 2 weekly checkup with my GP to make sure, in case of you feel any funny symptoms within your system, make sure you're speaking to them and let them check you up. Because to be honest, bleeding for a month, you'll be um restless, you'll be tired, and you don't want to
yeah.
go anemic as well if
Yes,
you're
it's
losing
also
that.
a blood test to check if I'm anemic. But
But
again,
Yeah, so
definitely,
you do a blood test to check your
yeah.
anemic.
So because
Well,
you
I
don't,
would
if you're
advise a
losing that much,
pelvic
yeah.
scan. So I think you said your GP has booked you for a pelvic scan, so
yeah,
that's
yeah,
good.
yeah, referred me for an ultrasound. Yes.
Yes,
So
so
what
that's
I
good.
can recommend is that you can also send us check with your GP, like you
Mm.
had Dr. Fikayo specialized, these are specialty. Send us an email on info.yourhealthmatters. You understand? info.healthmatters@yahoo.com in case you want, to speak to her or put in, you understand, message on your Health Matters, obviously not your personal stuff, to say, can you have a chat with Dr. Fikayo? She's on the page as well. If you're on the Facebook, you can always, but I think the best thing is get closer to the GP and follow the advice. I think I understand where you're coming from, but she just confirmed the medication is safe.
All right. Thank you very much, Dr. Fiki, and thank you,
Labake.
our host.
Thank you so much. Thank you so much. Really appreciate it. Thank you. Bye. That's actually a tough one because we
Yeah.
all know that getting the blood clots in the system, I don't know, but I think what I can just say to the caller is make sure you're checking with the GP. If I were you, every 2 2, then, at this stage, I will be very careful in terms of what I eat. I'll do more exercise, you understand, so that, your, the body is actually not, what's the worst that can happen? You're not staying in one place. You're
Mm.
active, the kind of food you eat, don't eat late, just like what Dr. Fikayo said earlier on, healthy living and everything. Thank you so much. I think before we wrap up, let me see if we can pick up a few questions on the live. You understand? So, thank you so much. How would the clothes come out? Somebody is actually asking, please call in because checking on your on the distance is not. So the number is 07345003484. We can still pick up one more call before we wrap up the show. And then I can promise you that Dr. Fikayo and I will go through the questions later if you want personal in this. But the best thing to do is speak to your GP. You understand? So somebody is asking you, Dr. Fikayo, how would so if the medication is clotting the blood, how would the blood then come out?
So what the medication does is it helps the blood clot normally. Okay. And what it does, how would it come out? It will come out through the vagina usually.
But it's going to be clotted.
Yeah, but it will come out through the vagina, but it wouldn't be as heavy. That's what it helps. So what it does, it's very specific. I mean, talking about the mechanism of it,
Mm,
it's actually quite specific and it's too much information. I
I
don't
know.
know how to explain it. So what happens is it stops the breakdown of something called fibrin, which is a protein that's important for clotting. So it allows the blood to clot and then it passes through. So what happens is you know normally when you get a cut, um, and it starts bleeding, what this does it stops the liquid flow, so it makes the blood stick together, and then it can start the healing process. So it stops you from bleeding excessively, basically.
Obviously, if it's not that watery, if it's clotted, it will reduce the flow.
Yeah.
All right, thank you. I think that's actually well explained. I think that answers your question. So once again, I want to say big thank you, Dr. Fikayo, for coming in to join us. I learned quite a lot because, like you rightly said, people don't talk about menopause. You know, I always
Mhm.
think we're too early. You understand? In the 48, 47, I was starting with a friend of mine, and they were saying, "Oh, we're too the studio line is not is going to voice me. Please, can you try and call again? The number somebody was online earlier on. That's why there's so try and call again. Somebody's saying they're trying to call the studio line. You understand? And it's going to voicemail. So you can try and call again, and let's see if we can pick up this call before we wrap up. So so you can try and call again um if you actually want to ask any questions. So there's a question here. How can men support the wife going through the menopause? I think that's been answered already. So it was because somebody was trying to call in, but the lady was online earlier. So I was like I said, I learned quite a lot. Menopause is something we all shy away from discussing. And I think my message today is about the andropause. And maybe whenever Dr. Fikayo feels again, we'll bring her back in terms of we'll dedicate that program to the male. You understand?
Okay.
So
Yeah, that
we'll
would be good.
dedicate it. Yeah,
Yeah.
we'll dedicate it because I've been accused to say we are always focusing on the female. So,
Oh.
and that was why I attached andropause to the menopause. Literally, the person that asked for this topic to be discussed literally asked for menopause to be discussed. And the husband said, your program, you're always focusing only on the female. What about we, the male? I said, okay,
Well,
we have the, yeah. So we have, I don't know why the, somebody's trying to call in and the thing is going straight to voicemail. Could be the network. So could be the network. So somebody's asking, can I, 1 minute, continue. Can I, let me see. Okay. Somebody's asking a question. Let me see if I can get the question out. Can I continue my beetroot supplements with the medication? So I think the
beetroot.
caller that beetroot supplements with the tranexamine acid. I think the caller is asking, so
Yeah.
does beetroot help? How does beetroot come into helping with?
I'm not really sure. I mean, you can carry on taking the beetroot. I don't think it doesn't interact with the tranexamic acid.
Okay,
So beetroot is fine.
okay. I think that answered the question. I think that answered the question. So I think the doctor just said you can actually carry on taking your beetroot supplements. To be honest, I was reading a particular let me just quickly dish this out. We are wrapping up now. So
Okay.
I was reading a particular supplement write up. We need to be very careful. All these our supplements, medication, all these our herbal, whatever remedies.
Oh,
We need
yeah.
to be very, very careful. Sometimes there are quite a lot of things that happen underneath all these things that we know we're just focusing on the benefits. We need to be, especially if you're actually having any underlying physical issue, you
Hmm.
need to be very careful for me, to be honest, I don't believe in taking any remedy about supplements, because I believe in just water. Water will do the job. Water water will do the job perfectly. So we need to be very careful in terms of all this our herbals. To be honest, all this chemical they're mixing, we need to be very careful. That's all I'm just gonna say. I was reading quite a lot of people talking about the side effects they later had with all this the supplements and everything that they were going on. So
Yeah, I mean there are some supplements that could help with menopausal symptoms, but there's no
okay,
studies. It's quite varied. Everybody has different reaction to it, so it's very difficult to
mm,
use because one person might use it and have an effect, and the other person might
right,
do and have no effect.
exactly. So that's why for me, there's a question there. I don't recommend, whatever um supplement is going to be your decision. It has to be your
Yes.
decision, because yeah, on the live Facebook, I'm not going to recommend any about or any
But it's
supplement,
also
because
always good to speak to your GP about if you're taking any supplements as well.
mm-hmm, mm-hmm,
So it's very important to discuss with your GP and ask them, is it safe for me to take
mm-hmm,
this?
mm-hmm,
Um, yeah,
mm-hmm.
so the GP is always there just to help and provide advice when needed. So don't be shy to contact your GP.
I think the problem here now is not even about being shy, it's about the getting the GP appointment.
Getting the appointment, I know.
I don't know for other people in the locality. I think our struggle now is getting that GP appointment.
Yeah, it's funny. I'm a GP, but I struggle to get a GP appointment.
You
So you
get
can
what I
imagine.
mean? So, and gone are those days that they stick to the emergency call. Them emergency appointment. These days you call in, and your number is 8 o'clock. You're calling 8 o'clock on the dot,
Yeah,
and
you're
your
number
number
40 on the queue.
40 something. I'm like, hello, how? I was in how? How did you get to number 40? I can't explain that. Trust me. We're all in the same, we're all having the same
We're
problem.
all the same. We're all the same.
So we all imagine the GP are telling you, I'm struggling to get a GP appointment. So bear with us. We're all in the same issue. And somebody was saying, I said, in my locality, we have a way that, when we are fed up, we have a way that we have to call their attention to say, you know what? This is not working for us anymore. So I want to say thank you so much to the two callers and everyone on the live Facebook. And I do apologize that my settings is in private. We'll review it and make sure I don't just like my settings to be in there. I'm gonna make sure we're using Elizabeth Akintoday page for Earth Matters
Yeah.
permanently, so that we don't have to come into my personal space. And I want to say thank you so much, Dr. Fikayo. Really appreciate. And like I said, we're bringing you back. So come and talk about the
I would
men.
love to come back. I
So for
enjoy
you
coming
guys out there,
here.
let us know what topic you want us to discuss, that the attention will be channeled on you. So till then, look after yourself. If you're feeling uneasy or unsure of anything in your body, please don't delay. Speak to your GP, dial 111. Even if you're in Nigeria, go to the hospital, get yourself checked up, make sure you're listen to all the tips in terms of a healthy lifestyle Dr. Fikayo gave us earlier on. Follow them. You all know these things now. Let's do them. So till then, look after yourself, stay blessed. Remember your ultimate is. Bye.
Bye.